Hey guys, welcome to this Mometrix video over life stages in client assessment. There are 5 major stages that we'll look at today. Here's what they are. Stage 1, initial disclosure. Stage 2, in-depth exploration. Stage 3, commitment to action. Stage 4, counseling intervention. And Stage 5, evaluation, termination, or referral. Let's look at what each of those mean. Stage 1, initial disclosure. In this stage, the main focus is relationship building. When I say relationship building, in this setting, I mean establishing rapport with the client that is based on trust, respect, and care. When there's a good relationship between you and your client, the likelihood of the session being more productive is greater. In this stage, you want to practice all the basic counselor skills that we discussed in the basic counselor skills video, such as empathy, genuineness, unconditional positive regard, etc. Here are some practical tips for helping to build a relationship with your client. Introduce yourself. Be personal and be inviting. Be hospitable. Invite the client to sit down. Ask them if they'd like water, coffee, or whatever you have. Make sure they are comfortable. Address the client by name. This is a big step in helping your client feel known. Be inviting of social conversation to help reduce any anxiety that they may be feeling. And remember, recognizing that they need and want help working through things can be a really big step. Be aware of nonverbal gestures as signs of the client's current emotional state. Allow your client to talk about his or her reason for coming in to talk. Indicate that you are interested in them and what they are going through. Remember, your client may talk about all their experiences from earliest childhood to the present, and the way you respond can either help them to trust you or lend to them feeling a betrayal of trust. One of the greatest obstacles in the relationship building stage is the tendency to move at too quick of a pace. Be patient with your client, be sensitive, and give them room to move at a natural pace. As trust begins to build between counselor and the client, they are more inclined to respond in a positive way as you encourage them to move towards change. Stage 2, in-depth exploration. In this stage, you'll hone in on problem assessment. One of the major reasons a client goes to talk with a counselor is to have help resolving problems or concerns that interfere with their daily lives and are causing them major heartache. The counselor should have the expectation to be an effective tool to help them move towards change. Assessment refers to anything the counselor does to gather information and draw conclusions about the concerns of the client. This stage should not feel like an interrogation to the client, but rather, they should feel that someone desires to know who they are, the things that have shaped how they think, how they feel, and their concerns. Psychologist Martin Seligman suggests the following reasons for assessing a client. Allow for counselors to make an accurate diagnosis. Discern whether or not a person is suitable for a certain type of treatment plan. Help counselors to develop a treatment plan. Help the counselors to have better clarification in setting goals and makes the achievement of goals more measurable. Helps the counselor to better facilitate the generation of options and alternatives. So now, let's talk about the different things that you will want to explore or assess. Identifying data such as the client's name, address, phone number, email, age, gender, marital status, occupation, etc. This enables the counselor to be able to contact the client, but it also gives insight into living conditions and background about marital status. Problems presented. How does the problem affect or interfere with the client's daily life? What behaviors, thoughts, and feelings are being provoked by the problem? How long has the problem existed and how often does it occur? Is there a pattern of events that lead to a problem, a person, and is the problem predictable? Client's current lifestyle. What does the client's typical day look like? What social, religious, or recreational activities are the client involved in? What is the client's education status? What are some special characteristics about the client, like age, physicalities, cultural characteristics, etc.? Family history. You want to gather information about both the father and the mother, things like age, occupation, personality, roles, and the client's relationship with each of them. Does the client have siblings? How many? How old are they? What is the relationship with each of their siblings? What was the stability of the family life like when growing up? Jobs held, family moves, and the reason for the move. Personal history. What is their medical history like? What about their educational history, like academic performance, extracurricular activities, hobbies, interests, relationship with peers? What about their career? What jobs have they had? What was the relationship like with their colleagues and bosses? What personal goals does the client have? Description of the client during the interview. What was their physical appearance like? Things like posture, dress, gestures, facial expression. How did the client relate to you, the counselor, during the session? Client's warmth, willingness, motivation, passivity, etc. Were the client's remarks logical? Did they flow, or were they all over the place? Summary and recommendations. Were there any connections between problems that the client stated and other information gathered? In your opinion, does the client need to be assigned to another counselor? Were the goals for counseling stated by the client practical and realistic? How much counseling, if you had to suggest, might be required? Stage 3, commitment to action or goal setting. Just like with anything in life, counseling needs to have a focus. The client's focus is going to be on the problem, but the counselor needs to be focused on the problem, the client, the counseling process, and the overall goal. Goals help to give direction during each session. In goal setting, the client identifies, with the help of the counselor, specific ways to move towards change and the best course of action to help make that happen. Clear goals can help to motivate your client to take the steps necessary in achieving those goals. It helps them to structure their lives in a way that makes reaching those goals more practical. Setting goals helps to eliminate sideways energy as the client and counselor set forth on the same page about what the goal is. In some cases, the client may be hesitant to set goals. It is possible that a person who resists setting goals could be protecting the very behavior that is in need of modification, because that behavior is also serving an underlying desire. For example, someone begins to recognize the negative consequences of an unhealthy, abusive dating relationship, yet they cling to it, claiming that that person makes them happy. Here are some helpful guidelines for selecting and defining goals. Goals should be connected to the desired end that the client is looking for. Goals should always be laid out in explicit and measurable terms. Goals should be attainable. Goals should not be outside of the knowledge and skill set of the counselor. Goals should always be focused on positive growth. Stage 4, counseling intervention. There are 3 steps within the counseling intervention stage. Step 1, summarize the problem. Step 2, identify a strategy. Step 3, select and implement intervention. Summarize the problem using the 4-dimensional analysis, which includes 4 different components: affective, behavioral, cognitive, and interpersonal and systematic component. The affective component. How do the problems make the client feel? How do these feelings affect the client's desire to change? How are the client's feelings sustaining the problem? What feelings could change the client's problem? The behavioral component. What does the client do in the midst of the problem? How do these behaviors support or sustain the problem? What behaviors could the client change to help reduce the effects of the problem? The cognitive component. What thoughts are going through the client's mind? What is the client saying to himself? How are these messages part of or adding to the problem? What cultural or personal beliefs or assumptions are part of the client's self-talk? How can these statements be filtered through truth to help the client recognize, identify, and weed out any false thoughts? The interpersonal or systemic component. What do the client's personal relationships look like? What are their interactions like with the opposite sex? How does the client interact with their primary support person or group? Do the client's relationships with family members affect the problem? How? Step 2. Identify the most helpful strategy for the client. The counselor must be equipped to carry out the strategy that is chosen. The strategy should simulate the character of the client's problem. For instance, if the client experiences the problem mostly in emotive or affective terms or states, then the strategy should engage them in that same way and be more relatable to them. The strategy should be decided on with the previous goals stated in mind. Everything should be directed towards the goal. The client's level of functioning should be considered when selecting an intervention strategy. Before the intervention strategy is implemented, the counselor should review it with the client. Step 3. Implement the intervention strategy. Now remember, we talked about choosing a strategy that relates to how the client experiences the problem. They may experience it more cognitively or more effectively. The goals of effective intervention strategies are to help the client express feelings or feeling states, manage feelings or feeling states, identify or discern between feelings or feeling states. Some feeling states may be so consuming for a patient that they need to be managed to function effectively. The client must express and recognize the feeling state. The goals of cognitive intervention are to reduce emotional distress and corresponding behaviors by correcting error in thought, perception, and beliefs. Cognitive interventions are meant to alter a patient's way of thinking about a particular event, person, self, or life. Cognitive interventions are based on the assumption that clients have the ultimate responsibility for the way they think about something. Stage 5, evaluation, termination, or referral. It may seem odd for someone beginning counseling to think of terminating a patient, but termination is something that you want to move towards. Ideally, termination happens when the goals that are mutually agreed upon by the counselor and the client have been achieved, or the problem has become more manageable or resolved. Researchers at Syracuse University say that termination should be one of the first topics the counselor and the client discuss. The counselor is ethically bound to discuss how long they are able to meet with the client, the timeline of the relationship, and to make helpful referral or recommendations at the conclusion of the counselor-patient relationship. Here are some helpful tips to appropriately move your client towards termination when ready. Remind your patient when the ending is coming. Do this at least 2 to 3 sessions prior to the final one. If you and the client are not constrained by a specific number of sessions, then it may be helpful to space out your last couple of sessions. This can help to sort of wean your patient off of any sort of emotional dependency on you, the counselor, and help them to begin to feel more confident. This may be more helpful than an abrupt end. Go back over the progress that has been made with the client. It's very common for the patient to lose sight of the progress that has been made. Ask your client what they learned, what they found helpful about the sessions, and how they felt about their cooperation in the process. Allow the clients to articulate what they are feeling in terms of termination. It's normal for them to have lots of emotions that need to be worked through, so time should be allocated to acknowledging and processing them. It's also important to be aware of your own feelings in terms of the patient's termination. It's a good thing to grow to care for the well-being of the patient. That is a really important part of counseling. Just remember that your aim is to be used to help get them to a place where they are not fully dependent on you. So, termination can oftentimes be seen as a great and hopeful thing. Those were the 5 stages in client assessment. I hope this video was helpful. See you next time.